No.
Okay, I'll just start over. So hypothyroidism, it's an endocrine disorder where an underactive thyroid gland is producing inadequate amounts of thyroid hormones T3 and T4. And in comparison to hyperthyroidism, it's when your body is producing too much of these hormones and your thyroid gland is overactive. So I just wanted to mention hyperthyroidism because it's another condition that is associated with hypothyroidism. But I'm going to be talking about hypo because it's more common. And the hyperthyroidism part of it, I just wanted to explain that again. And it's just going to be pretty much the opposite of hypothyroidism, but I just wanted to include that. So another thing that I found like surprising when I was researching this topic is that 97% of hypothyroidism cases are caused by Hashimoto's, which is actually something a little common that you may or may not have heard of. But another thing is that 1 in 5 Americans have hypothyroidism. And to be honest, I rarely have ever heard of hypothyroidism at all before I looked into the topic. So I just wanted to provide you with that statistic to just show that, it's very under-recognized diagnosis, but it's still pretty common. So before we understand what causes the condition, we need to understand its pathophysiology or the glands and things like that involved. So to start, the most prominent part of hypothyroidism would be the thyroid gland. It's located near the base of the neck, under the larynx, and above the trachea. The butterfly-shaped gland directs multiple bodily functions, including your metabolism, temperature regulation, and growth and development. And all of these functions occur with the release of a couple different hormones. These are T3 or tridothyronine and T4 thyroxine and calcitonin. So an important thing to remember is that T3 and T4 can't be produced if your body does not receive the required amount of iodine. And you might have heard of this term before, and it's because it's found in different types of food, but we're going to talk about that a little later. The hormones specifically help in burning calories, replacing dying cells with new ones, stimulating your sympathetic nervous system, increasing your body's temperature and heart rate, brain development, muscle contraction, fertility, and regulating TSH. TSH is a thyroid stimulating hormone in charge of producing these T3 and T4 hormones. So now we're going to look at the negative feedback loop, and that's just the whole process that your body goes through to produce these hormones. So with hypothyroidism, somewhere along this cycle, an issue occurs with either of the three hormones. So just looking at the diagram here, you start in the hypothalamus, and it produces TRH, like I mentioned, and that's thyrotropin releasing hormone. And it travels through your bloodstream to the anterior pituitary gland, and that produces TSH or thyroid stimulating hormone. And then that moves all the way to your thyroid gland, which produces that T3 and T4 hormone that I've been talking about. So there can be problems along the cycle with hyperthyroidism. And one of these problems could be the pituitary gland not stimulating the thyroid gland enough. So the hormones are not produced, or the thyroid is not receptive to the TSH from the pituitary gland. So again, that just means that somewhere along the line, one of the glands or areas is not being receptive to the hormones that it's releasing. Like I said, the thyroid gland may not be picking up the TSH correctly, which is why it's giving your body the condition of hypothyroidism. Now to identify the causes of hypothyroidism. So the most common reason for experiencing it would be the diagnosis of Hashimoto's disease. Hashimoto's thyroiditis is an autoimmune disorder. So these disorders can be very, very dangerous and harmful to your body. But again, it's kind of common here. So it's where the body attacks the thyroid gland, causing it to stop releasing these T3 and T4 hormones. This can result in various symptoms of hypothyroidism, including a possible goiter, which is kind of like a lump around the neck from the thyroid gland swelling up, from the constant thyroid stimulation, right? For trying to produce these hormones. Your body's kind of overworking itself because it's not receiving enough of these hormones. Another cause would be iodine deficiency. So as I mentioned before, you need a sufficient amount of iodine intake to prevent yourself from experiencing hypothyroidism. So again, the iodine deficiency, so you're not eating enough foods like the baked potatoes or canned tuna or milk and things like that. And these foods are crucial for even like a normal balanced diet. So as long as you're incorporating those, you should be receiving enough iodine. So this diagram here I just showed you, this diagram here, it's talking about pituitary tumors. That is also a cause for these different Hashimoto's, thyroiditis, and things like that. Because again, as I explained in the feedback loop, the pituitary gland is a pretty important part of this entire cycle. So if there's a tumor suppressing the gland, it's not going to produce the hormone correctly or even enough amount of the hormone. Like I mentioned, the TRH and TSH, those come before T3 and T4. So again, pituitary gland, really important. That's that part of it. And then Hashimoto's here. This picture here is just, again, showing some symptoms, which we're going to talk about next. So to delve deeper into these symptoms, I just want to present to you a short video listing some of these symptoms.
Symptoms of hypothyroidism can actually be very nonspecific, especially in children where occasionally we don't even see any signs. But the more common symptoms that you can have with hypothyroidism are an underactive thyroid gland. Includes feeling fatigued, being very, very tired, having weight gain, feeling cold all the time, increasing cold intolerance, being constipated, having hair loss, having dry skin, or having problems sleeping or with your menstrual cycle.
So if you didn't catch all of them, they're the first 8 on the list here. Some additional symptoms that she didn't mention were slow heart rate, depression, memory loss, or myxedema, which is swelling of the skin. That gives like a waxy appearance almost, joint and muscle pain, and a goiter, like I mentioned, the lump on your throat, right? So again, these symptoms, the first couple that she mentioned, you might not notice because, again, the thyroid gland is a pretty crucial part of your endocrine system. And you might think of it as just, oh, I'm gaining a little weight here. It doesn't seem like too big of an issue. It's just, maybe the time of year. I don't know. But it's actually when these symptoms are combined together, it becomes a pretty serious condition, obviously, because you're facing a real endocrinological condition. So again, if you feel like you're honestly experiencing any of these symptoms, you should probably contact your doctor and things like that. But again, those are just some common symptoms associated with hypothyroidism. So you can look out for those. So after understanding these symptoms, now we can talk about treatment methods. So for a patient experiencing hypothyroidism, they must undergo thyroid replacement therapy, which is the use of man-made thyroid hormones to raise the low levels of the natural thyroid hormones in your body. So some examples of these would be Cytomel, which would be lithoxin sodium, or Thyroller or Liotrix, and Synthroid, which is levothyroxine, which are all administered in a pill form, which is Synthroid is shown on the side here. Since the treatment deals with something as unstable as hormones, certain rules also must be followed for this treatment to work. So patients are told to never abruptly stop taking their medication, as it takes a while for these signs and symptoms to improve themselves and the hormone levels to start getting susceptible to the stimulation that they're receiving with these medications and actually start producing more of these hormones. It also takes, they have to take it at the same time every day in the morning without food, and they can't take it within 4 hours of multivitamins as it decreases the absorption of the thyroid medication. So again, the same time every day just gives your body the stimulation at the same time. So it's a repetitive, it's a pattern, your body knows to expect it, and it's expecting that stimulation. So they're like, oh, a couple minutes now, she's gonna take her medicine, and we're gonna need to start producing the T3 and T4 hormones again. So with these medications, they're also advised to watch for signs and symptoms of toxicity, which would mean these signs of the hypothyroidism coming back and showing that the medication isn't exactly working entirely. So that's all these types of medications. So again, I just want to talk about a couple of research papers that I read through. And with this, they kind of studied the social impact of the disease. They took a questionnaire within a couple populations, and there was a good percentage, I'm pretty sure it was 65% to 80%, that didn't know what hypothyroidism was, mainly because, again, it's kind of an under-recognized disease until you're actually experiencing it. So the point of this presentation was to obviously inform you on the disease, but also just show like it's an endocrinological condition that kind of is masked by the symptoms that you face. Unless you're really facing like the more severe symptoms like a goiter, you wouldn't think twice about like a couple pounds you gain or the appearance of your skin too much, right? So again, I just wanted to show you like it's a pretty big condition, but you need to learn a little bit more information about it before you know too much about it. So that just about wraps up my findings and research completed on hypothyroidism. I hope this kind of, again, introduced you to the condition and you learn a bit more. Thank you.
That was a really amazing presentation.
Thank you.
I definitely learned a lot, as everyone else definitely did. If anyone has any questions, please feel free to ask. I think the chat box should be working. Does anyone have any questions or anything? For either of us, I guess.
Sure. So hypothyroidism is an endocrine disorder where an underactive thyroid gland is producing inadequate amounts or not enough amounts of the thyroid hormones T3 and T4.
All right, everyone. Since no one really has any questions, I will post the attendance form for everyone. As again, please just follow all the rules and guidelines and stuff. And yeah. Okay, it should be working now. Sorry about that. Just like refresh it. Actually, just try this one. Yeah, that should be.
Also, you guys can let me know if you want me to go back to like a part of my presentation if you missed something.